Take care of yourself. That's not just a nice thing to say, it's also sound medical advice. Dr. Jill Sheeta is here to share how taking care of yourself can keep your breasts in their best health. Dr. Sheeta is in the radiology department at the Breast Center at Metro Health. Welcome to the show.
Thank you.
Now, you have 3 things that women should be doing to protect their breast health. So let's start with number 1.
Okay, so number 1 is going to be doing self-breast exams. So every month, every woman should do a self-breast exam. If a patient is still menstruating, then we would want them to do the breast exam about a week after their period begins. If a patient's postmenopausal, then we would want her to do that breast exam about the same time every month.
Okay.
And the best way to do it is to lay on their back, but make it so that their breast is spread out evenly. Use like really runny lotion so that you can palpate things easily. And you want to feel for any lumps, anything new, different, changing. And you want to make sure to look at the nipple and the under the arm as well.
Okay.
So those are important areas. You also want to look for any nipple discharge of clear, bloody, brownish. And you want to look at the breast and see if there's any dimpling or any redness of the skin. And if the patient sees any of those things, go ahead and talk to their physician so they can get checked out.
Okay. Is it just lumps you're looking for, or is it pain or anything too?
Pain usually isn't as concerning of an indicator for cancer, but certainly if someone has pain, we could assess that, so that's no problem.
So that's number 1. What's number 2?
Number 2 is going to be a clinical breast exam. So every year, in addition to that, the patient should have their physician perform a clinical breast exam. So either OBGYN or their primary care doctor, just to check out the breast as well. A lot of times they're familiar with how different breast tissues feel and can have an idea of what might be abnormal and what might not be.
Okay, so that makes a great deal of sense. What's the 3rd recommendation?
The 3rd thing is going to be starting annual screening mammography at the age of 40. Maybe earlier, depending on family history or any concerns that the patient has, but generally we're going to start at 40. And at Metro Health Medical Center, we actually have tomosynthesis, so the 3D breast imaging. So we can look at the tissues in a different way and get a different idea of what's going on in the breast and find cancer earlier.
Clearer and easier to see that there's problems?
Right, right. So it makes it easier for us to find the cancers, which is great.
Wow, okay, so what if there looks like there is an issue at one of these steps?
So if there is an issue, then we might end up doing what's called a diagnostic mammogram. So we end up looking at the breast with mammographic images just in a different way. We also might do a breast ultrasound too to look at the tissues again in a different way. If we're still concerned, we might end up doing a biopsy or maybe refer a patient to a clinician as well, an oncologist or something along
Somebody
those
who
lines.
specializes in breast cancer can really look closely at what's going on.
Exactly.
Now, I know that women are the main focus when you're talking about breast cancer, but men are also at risk?
Yeah, they could be, depending on family history, if they have the BRCA1 or BRCA2 genes. Sometimes depending on medications they take as well, it can increase their risk for breast cancer too.
Okay. So how do they know they've got the BRCA1 or BRCA2?
So they would have to get testing through the genetic counseling people, and they can look at that. Preferably if a family member had breast cancer, they can look at that family member and then
Does it matter if it's
a
family member who's male or female? It could be that the men then want to take a look at that?
Yeah, so they would want to check that out and see potentially. If there's a strong family history, it'd be something to look into.
Wow, all right. So very important information for our viewers.
Yes,
appreciate that.
Oh,
so,
you're welcome. You're welcome.
Self-exams, clinical exams, and a yearly mammogram. They're 3 easy steps that could save your life. My thanks to Dr. Sheeta for encouraging us to step up our awareness. To learn more, use the information that's coming up next.
To learn more, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, how to stretch your Social Security.